Jai Hind and a very good morning to respected Principal Sir, esteemed head of various departments, faculty members, dear students, and above all, our today's speaker, who is also our alumni, Dr. Apoorv Sharma. Online learning is not the next big thing. It is the now big thing, as quoted by Dona Abernathy. Subharti Dental College and Hospital, under the aegis of Swami Vivekanand Subharti University, is an endeavor of spreading knowledge and has previously organized various alumni lectures successfully. Reinforcing this practice, today we have with us Dr. Apur, who is going to enlighten us with the role of irrigation in endodontics. Without any delay, I would like to call upon Director PG Studies, Head of the Department from Conservative Dentistry and Endodontics, respected Dr. Vinita Nikhil Madam, to welcome our today's speaker.
Jai Hind Apoor.
Jai Hind, ma'am.
It's so nice to see you, and
Ma'am,
definitely it's a special occasion because I'm welcoming you once again after 2019.
thank you so much, ma'am. Thank you so much for inviting me.
Apoor, you know that while we are conducting this lecture series, this is known as SALS, and that means Subharti Alumni Lecture Series. This is actually an effort to connect the seniors to the juniors. And because you know, the seniors can motivate their juniors, and the alumni can contribute to their roots so that your juniors will do the wonders as you people are doing. We feel so happy, first of all, when we see you all progressing and touching the sky. And then I also go nostalgic when I remember the day when you entered my room that, ma'am, I'm going to join this department. And five girls, one boy, a mixed
Yes,
bag came to me. And then I saw that how in 3 years you have really strengthened your weakness, and not only in knowledge and skill, but I was very, very happy to see that you used to invest so much on your body. So I just wanted to tell all my students that this alumnus of Subharti used to spend his evenings in gym and motivate so many of others. Even my own son was very much motivated by Apoor. So I wish you all the best, Apoor. I know कि आप बच्चों, बिकॉज आपने पढ़ाई की है और आपको पता है कि एट व्हाट लेवल यू हैव टू गो डाउन टू मेक द थिंग अंडरस्टैंडेबल. तो ये बच्चों को आप बहुत अच्छे से ये स्पेशल टॉपिक बताएंगे, एंड दिस विल बी अ वेरी वेरी फ्रूटफुल सेशन फॉर ऑल ऑफ अस. Once again, I welcome you, Apoor, and would love to listen you. Thank you.
Jai Hind and a very good morning to all. It is with proud moment to welcome our esteemed alumni, Dr. Apoorv Sharma sir, MDS batch 2019, a skilled endodontist and an aesthetic dentist. He has completed his MDS from Subharti Dental College and Hospital, Meerut. Dr. Apoorv has handled more than 3,500 cases with his expertise in retreatment, perforation repair, instrument retrieval, epexification, and aesthetic restoration. All has been executed under magnification and rubber dam isolation. He has been a high school topper and a science Olympiad winner, as well as an NDA qualifier in 2011. A state level basketball player, he also holds multiple academic distinction during his undergraduation in 6 subjects and has scored highest marks in MDS Paper 1. He has also been awarded for various paper and poster presentation in national conference during his MDS tenure. We are honored to have him with us today. So please join me in giving him a warm welcome.
Jai Hind and a very good morning to all. Myself, Dr. Apoorv Sharma, alumni 2019 batch, Consent Endo Department, and today I will be presenting seminar on topic irrigation in endodontics. So, when we hear the term irrigation, the first picture that comes to our mind is irrigation literally means applying controlled amount of water to crop. By definition, irrigation means to wash out a body cavity or wound with water or medicated fluid. Irrigation dynamics refers to how irrigant flow, penetrate, and readily exchange within the root canal system, as well as the forces that they produce. Now the major question comes, why do we need irrigation? क्यों irrigate करना है? Just filing करो and obturate? No. We may think tooth anatomy is simple, but actually it's really complex. There are many areas in tooth apart from the main canals, known as lateral and accessory canals, where instrumentation is not possible. वहां कोई भी फाइल नहीं जा पाती. अब इन एरियाज में बैक्टीरिया रह जाते हैं. जहाँ बैक्टीरिया रह गया वहां वापस पैथोलॉजी डेवलप हो जाती है. पेशेंट आपके पास आएगा और कहेगा, डॉक्टर साहब पैसे तो आपने 5,000 ले लिए, दर्द मुझे 10 दिन में वापस हो गया. कैसा काम किया आपने? In a review article published under Vinita ma'am and Shikha ma'am on lateral canals, terminologies, classification, and prevalence in permanent and deciduous teeth, it was concluded that the frequency of missed lateral canal is more than 35%, constituting up to 12% of periapical pathology. Cantader et al. Observed that lateral canals are more common in multi-rooted teeth as compared to single-rooted teeth. Earlier, the concept was cleaning and shaping. Newer concept is shaping for cleaning. We have to shape the canals in a way that we should be able to clean them effectively. आपका irrigant easily flow हो सके to all areas. Hence, the biological objective is to produce antimicrobial effect and their capacity to effectively eradicate or maximally reduce intracanal bacteria. The mechanical objective include to flush out debris, lubricate the canal, dissolve organic and inorganic tissues, and detach and disrupt biofilms. Question comes, एक irrigant की क्या-क्या properties होनी चाहिए? First, it should have high efficacy against anaerobic and facultative microorganisms in their planktonic state and in biofilm. Secondly, it should be non-toxic when they come in contact with vital tissue. They should not cause anaphylactic reaction and should inactivate endotoxins. Coming on to the classification, Stock et al. Proposed two classes. First, chemically non-active solution, which included water, saline, and local anesthetic. Chemically active materials include alkalis like sodium hypochlorite, chelating agents like EDTA, oxidizing agents like hydrogen peroxide, antibacterial agents like chlorhexidine, acids that is 30% HCl, enzyme streptokinase, papain, trypsin, and detergent like sodium lauryl sulfate. Now coming to the various irrigants. First is normal saline. It is used as 0.9% solution, that is, it contains 9 gram of salt per liter ratio. It is used in root canal debridement and lubrication. It is one of the most biocompatible agents and it is used in conjunction with chemical irrigants. Distilled water does not have any antibacterial or antimicrobial effect. However, in a study by Santos et al., it was concluded that heated distilled water with or without continuous ultrasonic irrigation improves final irrigation efficacy and reduces dentine erosion. Sodium hypochlorite solution is the most frequently used because of its antibacterial capacity and ability to dissolve necrotic tissue, vital pulp tissue, and organic components of dentine and biofilm in a fast manner. Hypochlorite was first produced in 1789 in France, used as a hospital antiseptic, and sold under the trade name of Usol or Dakin solution. In 1919, Coolidge introduced it to endodontics as intracanal irrigation solution. Its mechanism of action include saponification reaction, neutralization reaction, hypochloric acid formation, and solvent action due to its high pH. Coming to the various factors affecting its function. First is temperature. आप टेम्परेचर बढ़ा दो लो कॉन्सेंट्रेटेड सॉल्यूशन का, उसकी इमीडिएट टिश्यू डिसोल्यूशन कैपेसिटी इंक्रीज हो जाएगी. Second is concentration. It is used in 0.5 to 6% for root canal irrigation. Higher concentration has better tissue dissolving ability. Lower concentration, when used in high volumes, can be equally effective. Higher concentration are more toxic than lower concentrations. Third is time. Now, sodium hypochlorite acts by producing chlorine ions. They get utilized in 2 minutes. Hence, continuous replenishment is very important. Fourth is toxicity. If used without caution, it is very toxic and destructive to intraoral soft tissue, the periradicular vascular and cancellous bone. Severe inflammatory responses and degradation of organic components can occur due to its high pH and strong oxidizing capacity. If it comes in contact with tissue or by mistake injected in tissue, it can cause severe pain. It can cause edema of neighboring soft tissue, possible extension of edema over injured half of face or upper lip, cause profuse bleeding from root canal, profuse interstitial bleeding with hemorrhage of skin and mucosa. The patient may complain of chlorine taste. There can be irritation of throat after injection into maxillary sinus and secondary infection or even reversible anesthesia or paresthesia is possible, which is known as a sodium hypochlorite accident. Now coming to ethylene diamine tetraacetic acid, also known as EDTA. It was first introduced into the endodontic practice by Nygaard Otsby in 1957. Its mechanism of action include its 17% EDTA forms highly stable soluble metal chelates. It forms a calcium chelate solution with the calcium ion 13, making it more friable and easier to instrument. When difficulty in introducing a file into the canal due to intracanal calcification or iatrogenic blockade, EDTA gel can be used. It must be remembered that sodium hypochlorite and EDTA are not to be mixed, as their interaction makes sodium hypochlorite to lose its tissue dissolving capacity. 5.25% sodium hypochlorite for irrigation during the shaping of the root canal, followed by 17% EDTA for 1 minute as a final rinse before obturating the canal is recommended. Now coming to chlorhexidine, it is a wide spectrum antimicrobial agent active against gram-positive, gram-negative bacteria and yeast. Unlike sodium hypochlorite, it is capable of remaining in dentine due to its cationic nature. Its absorption to dental hard tissue with gradual and prolonged release at therapeutic levels is called the residual effect or substantivity. However, it has certain limitations, that is, it lacks tissue dissolving ability and it does not remove the smear layer and hence has to be employed in conjunction with other irrigants. Other irrigants are HEBP, that is 1-hydroxyethylidene 1,1-bisphosphonate, also known as etidronic acid, which is used in 18% concentration. It is a weak chelator and is a potential alternative to EDTA. HEBP does not interact with sodium hypochlorite, thus can be used in conjunction. Iodine potassium iodide is used in concentration of 2 to 5%. Its potential disadvantages are it can cause allergic reaction in some patients. MTAD is a mixture of 3% doxycycline, 4.25% citric acid, and 0.5% polysorbate, and it is commonly employed after initial irrigation with 1.3% 3 percent sodium hypochlorite. 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 3 percent sodium hypoc A combination of 5% sodium hypochlorite, hyperq, and 17% EDTA is known as a Ruddle solution. Herbal irrigants such as propolis show antimicrobial activity equal to that of sodium hypochlorite. Triphala and green tea polyphenols, ethanolic extract of neem, had significant antimicrobial activity against E. faecalis biofilms. Now coming to irrigation techniques and devices. First, there is manual. In manual, the most commonly used is syringe irrigation. In this, 1 to 5 ml syringes is recommended. 25 gauge tip can reach a size of 35 canal and 30 gauge tip can reach an apex of size 25 canal. 27 gauge needle is preferred needle tip size for routine endodontic procedures. Needles can be flat, beveled, notched, side vented, double side vented, or multi vented. Coming to canal brushes, they are basically of two types, that is navy tip and navy tip FX. These brush help by assisting in debridement of the canals. The drawback was that the separation of radiolucent bristle into the canal irregularities, which became difficult to be identified or removed. Endo brush is a spiral brush that consists of nylon bristles set in twisted wire with an attached handle, and it helps in debridement of the canal. Coming to manual dynamic irrigation, in this method, a well-fitted greater taper Gatta-Pacha master cone is moved up and down the instrumented canal, containing the irrigants in a short 2 to 3 mm strokes. The frequency of push-pull motion of the Gatta-Pacha point is 100 strokes per 30 seconds. ये मेथड हम यूज कर सकते हैं in absence of any irrigation devices, and it is an effective method in cleaning of the canal. Now coming to the machine assisted system, first are rotary brushes. They include Ruddle brush and canal brush. These are micro brushes attached to a rotary handpiece rotating at 300 rotation per minute. Now coming to continuous irrigation devices, an example is Vatia system. It is a self-contained fuel delivery system which is an integral part of self-adjusting file system. The flow of irrigant can be controlled from 1 to 10 ml using a foot pedal. Coming to sonic agitation, it uses low sonic energy that ranges between 1000 to 6000 Hz onto files within the canal to generate the streaming of the irrigant. It was first introduced by Dentsply. It consists of a portable handpiece and three different type of disposable polymer tips of different sizes, that is small, medium and large. 10,000 cycles per minute has been shown to optimize debridement and promote disruption of the smear layer and biofilm. Coming to ultrasonic agitation, it uses ultrasonic energy between 25 to 30 kHz, hence ultrasonic. It is of two types, that is, when irrigation is combined with simultaneous ultrasonic instrumentation and another without simultaneous instrumentation, so-called passive ultrasonic irrigation. In passive ultrasonic irrigation, the energy is transmitted by means of ultrasonic waves and can induce acoustic streaming and cavitation of the irrigant. In acoustic streaming, at the tip of the file, there are formation of nodes and antinodes, which help in rapid movement of fluid in a circular or vortex-like motion around a vibrating file. In cavitation, there is the creation of new bubbles or the expansion and contraction or distortion of the pre-existing bubbles, so-called nuclei in a liquid, and they help in cleaning of the canals. An important phenomenon to know is known as a Weber lock effect. It is represented by the production of air or gas bubbles inside a close-ended system. There is formation of bubbles in the apical third of the canal, which leads to the impossibility of irrigant solution to chemically reach those areas. Thus, studies have shown that while using passive ultrasonic irrigation or sonic activation, this air bubble can be removed. Coming on to the pressure alteration device, an example is Endovac system. It consists of three components: the master delivery tip, macro cannula, and micro cannula. Macro cannula is made up of plastic, flexible polypropylene, which is an open end used to suction irrigant up to the middle segment of the canal. Micro cannula is made up of stainless steel and has 12 microscopic holes and is taken to the working length to aspirate irrigants and debris. In laser activation irrigation, we use lasers. The different lasers that we use are Nd:YAG laser. In this laser irradiation significantly reduce the number of E. faecalis, but it is inferior to sodium hypochlorite irrigation. Holmium YAG laser shows excellent antimicrobial efficiency against E. faecalis. Carbon dioxide laser remove the smear layer on the instrumented canal walls. Waterlase I plus is a laser by Biolase. It works deep into the dentinal tubules to kill more bacteria without the use of sodium hypochlorite irrigators. Significant reduction in bacterial counts in only 3 minutes compared to 20 to 30 minutes for conventional treatment was observed. Then there is photon initiated photocaustic streaming, also known as PIPS. It uses erbium YAG laser energy at sub-ablative power levels. In this, a modified tip placed submerged in an irrigant at the chamber of the root canal, and it uses low energy pulses at a rate of 15 Hz and is repeated 3 to 4 times for 20 to 30 seconds each time. Coming to the ozone based delivery system. Ozone is unstable and dissociates readily back into oxygen and thus liberating a singlet oxygen, which is strong oxidizing agent which further impose the deleterious effect on microorganisms. Ozone works best when there is less organic debris remaining. Therefore, the recommendation is to use either ozonated water or ozone gas at the end of the cleaning and shaping process. Ozone is effective when it is used in sufficient concentration for an adequate time. In multisonic activation, it delivers a stream of treatment solution including EDTA, sodium hypochlorite, and distilled water from the handpiece tip into the pulp chamber, while excess fluid is simultaneously removed by the built-in vented suction through the handpiece. The best part is it results in negative pressure and zero extrusion at the apex. The gentle wave system provides tissue dissolution of 8 to 10 times faster than the ultrasonic devices and needle irrigation, respectively, making it one of the most effective methods. Thus, to conclude, irrigation plays a key role in successful root canal treatment. Many irrigant solutions have been proposed which are effective in lavage of debris and each has its own distinct properties. Therefore, when used in combination along with various irrigant delivery systems, efficacy can be further enhanced. Irrigation devices have been developed which provides effective cleaning and superior debris removal in order to replace the traditional needle irrigation methods. These are the list of my references. Now, the second part was to tell about myself and my experience in Subharti. Subharti College के third floor पे there is famous department of cons and endo, and then there is that PG section. Once you enter there, on the left side you can see me hanging there along with my bike. That is Kritika Ahuja. Yes, we both are alumni of Subharti Dental College, Endo Department. In 3 years of my life, I made my best memories. There were days we laughed, some days we cried, some days we were sad in the first half, happy in the second half, and some days vice versa. कभी विनीता मैम की गाड़ी दिख गई राखी के सामने, फॉर्मूला वन की रेसिंग तो वहां स्टार्ट होती थी. Coming to the major question about PG. Will it be easy? No. Worth it? Absolutely. Me and my wife are sole private practitioners. We have two running centers by the name Uno Dentals, one in Roorkee, other in Mohali. In addition, we go for endo consultations in Roorkee and Tri-City. With all my heart, I'm telling you all, this is possible because of these people, especially Vinita ma'am. Just two things about ma'am. She is very, very famous. I have done consultation at many places. Many people know her, either by name or by face. कई बार तो कंसल्टेशन मैम के नाम से मिल जाती थी कि अच्छा आप विनीता मैम के स्टूडेंट हो. एंड सेकंड, देयर इज सेइंग अमंगस्ट अस एलुमनाई, अगर तुम सुभारती डेंटल कॉलेज एंडो डिपार्टमेंट से निकले हो तो कुछ बनकर ही निकलोगे. I proudly say I am an alumni of Subharti Dental College and Hospital. Thank you and Jai Hind.
Thank you, Dr. Apoorv, for such an informative session. Dr. Apoorv, if you permit, there is a query for
Yes,
one
sir.
of the queries there.
Yes, sir. Yes,
How
sir.
does the use of chelating agents like EDTA will affect the action of sodium hypochlorite?
ईडीटीए और सोडियम हाइपोक्लोराइट को ना मिक्स नहीं करना चाहिए, क्योंकि ईडीटी क्या है, वो सोडियम हाइपोक्लोराइट की ना टिश्यू डिसॉल्विंग कैपेसिटी डिक्रीज कर देता है. यूजुअली आपको क्या करना है कि जब भी आप दोनों में से कोई भी इरिगेट करो, सपोज आपने हाइपोक्लोराइड यूज किया, उसके बाद इरिगेट करो, इरिगेट फॉर 1 मिनट, देन इंट्रोड्यूस अनदर इरिगेट. जैसे आपने ईडीटीए फिर इंट्रोड्यूस किया, उसको फिर इरिगेट किया, फिर आपने उसको फ्लश किया. सिमिलरली सोडियम हाइपोक्लोराइड और क्लोरेट वो नहीं मिक्स होना चाहिए. उसमें क्या है, उसमें एक प्रेसिपिटेट बन जाता है ऑरेंज कलर का. तो दोनों इरिगेंट्स के बीच में आप जो है फ्लशिंग एक्शन रखो, देन इट विल बी फाइन. मिक्स नहीं करना.
Okay. Thank you, Dr. Apoorv. There is another one query, Dr. Apoorv, I'd like to share with you, if you permit.
ये सर,
So another question is, sir, how do the flow dynamic of irrigating solution will affect the disinfection within the root canal system?
शालिन सी, सबसे पहले ना आप देखो, एक वाटर है वो स्टैग्नेंट. स्टैग्नेंट वाटर कोई मूवमेंट नहीं दिखाता. जैसे आप घर में बर्तन भी साफ करते हो, आप जाके सीधा उसको रख दो, मतलब पानी में रख दो, वो साफ नहीं होगा. लेकिन जब आप उसको मूव करोगे, जब आप पानी को मूव करोगे, ठीक है, उसमें क्लीनिंग एक्शन आ जाएगा. सेम इज द केस विद द रूट कैनाल. जब भी आप उसमें एक एक्टिवेशन लाओगे, एक्टिवेशन से क्या होता है कि जो कैनाल की वॉल्स है उससे ना आपका इरिगेंट टकराता है, तो उससे जो है जो बैक्टीरियल बायोफिल्म्स हैं, जितनी भी डेब्री है, वो ना फ्लश आउट ऐसे रहती है. सेकेंडली आपका इरिगेंट ना रिप्लेनिश होता रहता है. तो हम हमेशा बोलते हैं कि यस, यू हैव टू यूज एन इरिगेशन डिवाइस. इन 2020 इन द सेकेंड ईयर, मैम ने हमको बोला कि आप ना एक्टिवेशन सिस्टम यूज करो. एंड आई एम टेलिंग इट बाय हार्ट, ऐसे नहीं मैं बता. फर्स्ट हमें बिल्कुल अलाउ नहीं था कि हम विदाउट मैग्निफिकेशन एक्सेस करें, इवन आवर जूनियर. मैम बोलते थे, मैम जब चले जाते थे, कुछ लोग होते थे वो अपने लूप उतार के रख देते थे. हम 2-3 पीजीज थे, वी स्टार्टेड, मतलब हमने लूप के अंडर काम किया ही किया. फिर उसके बाद एंडो डिपार्टमेंट के अंडर माइक्रोस्कोप भी आया. मैम ने बहुत मोटिवेट किया एंड वी यूज इट. आई एम टेलिंग यू क्यों वो कर. नाउ व्हेन आई एम डूइंग कंसल्टेशंस, मैं आई एम प्रोबेबली द ओनली एंडोडोंटिस्ट हु यूज लूप. और बाकी डॉक्टर्स को पता लगता है, एंड इट वाज मतलब ये मैम एंड सुभाटी एंडो की देन। तो इस केस में क्या वो मैं बोलना चाह रहा हूँ कि आप कोई भी एक एक्टिवेशन सिस्टम यूज कर लो। लाइक आई परचेज अल्ट्रा एक्स इन 2020 एंड आई स्टिल हैव विद मी। आई आल्सो हैव सोनिक एंडो एक्टिवेटर भी है मेरे पास। तो मुझे पता है कि सुभारती में बहुत इनफ्लो है, नहीं टाइम मिलता। सुबह का 1 या 2 पेशेंट आप अपने लिए रखो, ठीक है? उसमें बहुत अच्छे से इरिगेशन करो, प्रॉपर प्रोटोकॉल फॉलो करो, जो आपके गाइड मैम बताते हैं उसको फॉलो करो। इसका इफेक्ट आपको बाहर निकल के मिलेगा। जब एक बार आप इरिगेशन करना, ठीक है, यूज करोगे, उसके बाद आप देखोगे अपनी आरसीटी बहुत अच्छी आती है। तो एक्टिव इरिगेशन इरिगेंट डायनामिक्स का मतलब कि यस, वी हैव टू परफॉर्म समटाइम्स एनी टाइप ऑफ एक्टिवेशन मेथड। ये आपको करना ही करना है एंड स्टार्ट फ्रॉम दिस स्टेज ओनली। आगे बहुत फायदा है।
There's another query coming up, Dr. Apoorv, that how would you modify the irrigation protocol in the case of internal root resorption with or without perforation to ensure through thorough cleaning and disinfection?
देखो आंसर सेम है। देखो अगर हमारे पास परफोरेशन नहीं है, आप क्या कर सकते हैं, 2.5 या 5.2% सोडियम हाइपोक्लोराइड की कंसंट्रेशन यूज कर सकते हैं। एंड यू हैव टू यूज एनी एक्टिवेशन डिवाइस। एक्टिवेशन क्या करेगा कि जहाँ आपकी फाइल नहीं जाएगी वहाँ वो आपका इरिगेंट पहुँचा देगा। सपोज आपको परफोरेशन है, आपको लगता है कि हाँ पेरियापाइकल एक्सट्रूजन के चांसेस हैं, आप ना सोडियम हाइपोक्लोराइड की कंसंट्रेशन कम कर दो, 1% यूज करो। एंड अगर पॉसिबल कोई भी जैसे इरिगेशन डिवाइस जैसे एंडोवैक हम वैसे बोले नहीं परचेज हो पाता, तो उस केस में क्या है, आप सोनिक या अल्ट्रासोनिक एक्टिवेशन यूज कर सकते हो। इट विल बी वेरी हेल्पफुल। आपका जितना भी एरियाज है वहां तक आपका इरिगेंट अच्छे से फ्लो हो जाए। कुछ स्टडीज ये भी बोलती हैं कि वंस यू हैव परफॉर्म फाइनल इरिगेशन विद ईडीटीए, और अगर सपोज नेक्रोटिक है, आप उसके बाद क्लोरहेक्सिडिन यूज कर सकते हो या फिर सिट्रिक एसिड, मतलब एज अ फाइनल इरिगेशन। मतलब कुछ स्टडीज बोलते हैं, बट क्लोरहेक्सिडिन विल डू वो सब्सटेंटिविटी इन केस ऑफ एवर नेक्रोटिक।
Okay. One last question is there, Dr. Apoorv, that what is your clinical recommendations for using NaOCl in different clinical situations? For example, if you are dealing with a vital tooth or a non-necrotic pulp.
नेक्रोटिक पल्प में ना बैक्टीरियल लोड बढ़ जाता है। जैसे वाइटल पल्प में तो क्या है, हमने इरिगेंट यूज किया, उसके बाद फ्लश आउट किया, फिर 17% ईडीटी किया, करना वही है, लेकिन हमें क्या है इरिगेशन ज़्यादा करना है। क्योंकि एज कम्पेयर टू वाइटल पल्प, नॉन वाइटल पल्प में ना बैक्टीरिया बहुत ज़्यादा होते हैं, डेब्री बहुत ज़्यादा होती है। तो आपको जो है ना, फर्स्ट यू कैन डू कि अगर आपने आइसोलेशन अच्छे से किया हुआ है, यू कैन यूज हायर कंसंट्रेशन ऑफ सोडियम हाइपोक्लोराइड। आप 5.25% यूज कर सकते हो। मेक श्योर यू आर यूजिंग इट अंडर आइसोलेशन, क्योंकि अगर वो बाहर टिश्यू से कांटेक्ट में आया तो इट कैन कॉज टॉक्सिसिटी। एंड सेकेंड, यूज एन एक्टिवेशन मेथड। आप जो है एक्टिवेशन एंड रिप्लेनिश करते रहो, आप अपना इरिगेशन का टाइम थोड़ा सा बढ़ाते हो इन केस ऑफ नेक्रोटिक। वाइटल में वही 15 to 20 मिनट्स, नॉन वाइटल में थोड़ा सा इरिगेशन टाइम और कंसंट्रेशन थोड़ा सा आप बढ़ा।
Thank you, Apoorv. Thank you for your valuable tips for irrigation. Now, I would like to call upon respected Principal Dr. Nikhil Srivastav, sir, to hand over the certificate to our today's speaker.
Hi Apoorv, Jai Hind.
जय हिंद सर, गुड
See
मॉर्निंग।
you to Subharti, though in online form, but then still. So, how are you doing?
आई
How's
एम डूइंग
everything?
गुड सर।
Very nice. So, I was listening to your lecture. It is really informative. Um, and moreover, because you are practicing all these things, so I think that makes sense. The irrigation protocol in my specialty are particularly very important, rather more important than endodontics, because we have the tortuous canals, we have a lot of ramifications. So in our field, no, instead of you calling it cleaning and shaping, we call it as chemomechanical root canal preparation, and the irrigation plays a vital role, no, for the success of endodontics. So you have almost covered everything. I was just listening to your lecture, and I hope that all the students and the residents who are listening to your lecture must have been benefited. So thank you, Apoorv. On behalf of Subharti Dental College and Hospital, kindly accept this certificate of presentation and appreciation from our side. And keep rising, keep doing good work, and keep the flag of Subharti high in your area and wherever you go as consultant.
Thank you so much, sir. Thank you so much. Sir, I still remember when I came into your cabin regarding one of my query and you just called. It's always brings so much memories back. The ma'am का call आया कि अपूर्व lecture देना है. I was so thrilled and excited and nervous too. But sir, मतलब frankly speaking, जो सुभारती डेंटल कॉलेज से मैं सीख के निकला वो बाहर बहुत बहुत काम बहुत काम frankly.
वंडरफुल, वी आर हैप्पी। एक्चुअली हमारे ऑब्जेक्टिव्स यही हैं कि जो स्टूडेंट्स हमारे पास आते हैं उनकी एक अच्छी लर्निंग हो, और नॉलेज और स्किल्स अगर आपके पास दोनों चीजें हैं तो कॉन्फिडेंस ऑटोमेटिकली आ जाता है।
Sure, sir.
And all these three things are very important for your success in your life. क्योंकि अदरवाइज तो हम लोग देखा है मेजॉरिटी ऑफ कॉलेजेस में बच्चे अंडर ट्रेन्ड है, अंडर स्किल्ड है, और उसकी वजह से अंडर कॉन्फिडेंट है, एंड दे जस्ट सर्च फॉर 20,000 जॉब और 25,000 जॉब, जो हम लोग नहीं एग्री करते हैं। तो इसलिए यहाँ पे रगड़ाई बहुत होती है, इसलिए यहाँ पे डिसिप्लिन जिसको आप कहते हो जब आप स्टूडेंट हो तो आपको सारी बातें बुरी लगती हैं, बट आई एम श्योर आप पास तो आप उसको अप्रिशिएट करते हो कि यस दीज आर द नीड आर द आर्ट्स, राइट?
All worth it, sir. All worth it.
All right, Apoorv, thank you very much, and
Thank
keep be in contact with your own alma mater, ठीक है?
sure,
फिजिकली
sure.
और ऑनलाइन जैसे भी हो आप आते रहो और कनेक्टेड रहो, ठीक है?
Thank you so
All-
much, sir, for inviting me.
Thank you, blessings, bye, bye.
Thank you, sir. On behalf of Department of Conservative Dentistry and Endodontics, Subharti Dental College and Hospital, I extend a heartfelt thank you to our esteemed alumni Dr. Apoorv for sharing such valuable insights with us today. A big thank you to our head of the department, Dr. Vinita Nikhil ma'am, for providing me with this opportunity. Also, I would like to thank Dr. Ruchika, Mr. Jatin, Shubham, and above all, my postgraduate students for making this session a success. Thank you all. Jai Hind.
All the best. Thank you very much.